Hi, my name is Kiersten Shyian. My student number is T00678685, and I will be demonstrating the anatomical features on my dog Hera today. You sit. Sit. Go. So if we start with the incisive bones, the incisive bone is kind of right in the mouth there that holds the incisors in. If you do your nasal bones, you have two along the side here. If we do the maxilla, maxilla is our upper jaw area, just kind of below the nasal bones. If we go with the frontal bone kind of runs along in this area on the top of the head. So we got the frontal bone there. We have the temporal bones running under the frontal bone. That do include the zygomatic arch there, so those are kind of underneath the temporal. Our parietal bone is up on top behind the frontal bone here. And then we have the occipital bone at the base, at the back of the skull. The mandible is the lower jaw. So all of our lower jaw here, and then we have our ramus that runs kind of up at a 90-degree angle. And the temporomandibular joint would also be here, kind of in this general area. It's where the jaw is going to open from. Nasal turbinates and nasal sinuses. So the sinuses and turbinates are found in this general area behind the nasal bones. And then we do also have the external auditory meatus, which is kind of the big lump just right under the ear that kind of sticks out a bit right here. Now, if we move to the spine, we have our cervical vertebrae, which run from the back of the head down the neck here until we meet the ribs. And then when we meet the ribs, then they become the thoracic vertebrae. So we have our C1 and our C2, so our atlas and our axis bone. They basically attach to the occipital bone at the back. And they are what helps the dog move their neck and all that good stuff. So you would have your thoracic vertebrae attached to your ribs. So you would have dorsal processes, the dorsal spinal processes, which are basically, if you run your fingers down, that's where you can feel where their actual spine is. Transverse processes would stick out the side, so you can kind of feel them if you palpate. She's a little chunky right now, so I can't quite feel them. Your lumbar vertebrae begin where the last rib ends. So once they're no longer thoracic vertebrae, they turn into lumbar vertebrae. Same thing with these. The dorsal spinous processes would be on the top here, and I can feel them. And then the transverse would be kind of on the side here. You then move down into the sacral vertebrae. So your sacral vertebrae are usually fused into your sacrum. And then the tail, when you get to the tail, they turn into coccygeal vertebrae. So all of those are coccygeal vertebrae. Her ribs, obviously, like I said, they're up with the thoracic vertebrae, so you can feel the ribs here. Normally in a dog or cat, you would have 13 ribs. The sternum, or the breastbone essentially, would be found here. So I can feel her sternum right now. The manubrium is the top of the sternum. It's that top point there, whereas the xiphoid process is the one at the bottom that meets there. Costochondral junctions are where the ribs are going to actually meet your sternum. So kind of at the end of the ribs, there is cartilage that forms it to the sternum. Okay, so now we're going to move to the thoracic limb. So our scapula is the shoulder blade. So you can feel essentially the wing of the scapula up here. And then it kind of branches out like this, and then moves into a neck area. The spine of the scapula, I can feel along here. It's kind of a ridge that goes along the spine, or the bone there. The humerus is this bone here. So we've got, if you go down from the scapula to about the elbow area, that's where the humerus is. The greater tubercle of the humerus is up in this general area here. It's kind of what helps it attach to the scapula. And then we have the radius and ulna bones. Can you lay down? Roll over. Okay. So we have your radius and your ulna here. So we've got your radius and then your ulna. And then your olecranon process is kind of up here. It's the part that just juts out behind the elbow. The carpus would be this area. There's lots of little bones in this general area here. If you move down, you have your metacarpal bones, to which you should have 4 in a dog or cat. They would number from medial to lateral. So you would have 1, 2, 3, 4. And then if you move down here to the digits, got your phalanges. So you'd have 1, 2, 3, 4. But if you actually use the digits, so this would be your distal phalange. This would be your medial phalange or your medial phalanx. And then your, proximal phalanx. So that would be where all of the bones are in the front limb. And then we are going to do the back limb. You've got your pelvis area here. You've got the pelvis. The wing of the pelvis, you can feel when the dog is standing up there. You can feel that wing of your pelvis, which would be your ilium. Then if you move down to the ischium, your ischium would be kind of back in this general area. It's the part that sticks out in the butt area there. Then the pubis in general is kind of like in the middle. It's the more fused point, which would contain, you would have your acetabulum, which is where the femur is actually going to connect on the pubis. So it's basically like a big slot that the head of the femur goes into. And the head of the femur is medial. It's the medial side of this. And it goes right into the acetabulum, whereas your obturator foramen is basically a big hole in the general pelvis, your pubis bone, which helps to lighten the weight on the pubis, your pelvis. Okay, so then you got your femur up here. Your greater trochanter would be the lateral side of where the head is of the femur. And then if you move down here, you've got your knee or your patella, which is at the bottom of the femur and just at the top of the tib fit. So your tibia is going to be the inside bone, so it's going to be the larger bone here. And then you've got the fibula, which is on the outside of this bone as well. So if you do your tibial tuberosity, that's going to be up in this general area where it meets with the knee. You can kind of feel that right there. It sticks out at the front. And then if you follow the leg down, you can feel the tibial crest as well. And then we have the tarsus. So this general area is the tarsus because it's in the hind limb. The calcaneus is this part that sticks out right here. Metatarsal bones should also have 4. Metatarsal bones. Your tarsal bones would be here. Your metatarsals would be here. And they are also numbered medial to lateral. So 1, 2, 3, 4, or 1, 2, 3, 4. And then you would have your digits as well. So your digits are the toes. And then you would have your your proximal, your middle, and your distal digits. So there should be 3 on dogs and cats. All right, and last we are going to talk about the lymph nodes. So we do have the mandibular lymph nodes, which are kind of right under the mandibles there. You have your parotid, which are up slightly higher than the mandibular ones. So should be mandibular, parotid. We've got the axillary, which is right in the armpit, so should be right up in there. Your pre-scapular, if you find your scapula, would kind of be right in front of them here. That would be where your pre-scapular are. And then we would also have the inguinal ones, which should be right here in the inguinal region, kind of right in this general area. And then we have the popliteal, which can be found in the back of the knees. So they're kind of found there.